All right, let's start off with your name and tell me how you heard about Ibogaine and where you were living and what your intake was and all those details that we usually get to later on.
Okay, my name's Juliana.
What's your last name?
Mulligan, and I was living in Colombia for a year and a half. And
What area?
In Bogota. And I started last March. I relapsed with opiates, and mainly I was eating fentanyl patches, but I was doing everything: morphine, oxy, Dilaudid, methadone, buprenorphine, anything they had, but mainly fentanyl because it's the strongest. And I was eating a whole fentanyl patch a day, and the pharmacy was selling it to me without a prescription. Extremely cheap delivery to your house, so it was easy for me to continue. But I wanted to stop months ago, and I couldn't because of the sickness. I've known about Ibogaine for 4 or 5 years, and I considered ordering it myself and doing it myself, but that didn't happen. I told my parents, and they sent me here.
All right, so tell me a little bit about your experience.
Well, I came here, and my second day, we started the Ibogaine treatment. And I remember the beginning. Everything got really wavy, there was a buzzing, and then I just don't remember anything for 2 days.
You want to tell everybody your intake, the equivalent of what it would be in oxycodone?
Maybe about 1,600 milligrams a day, maybe more. It's hard to say. Fentanyl is really strong, especially a whole patch when you eat it. So
it's enough to kill a camel.
Enough to kill a lot of people, even a
Why do you think your tolerance was so high? Do you think
because I just was able, I had unlimited amounts, and fentanyl tolerance builds up really fast. And I've always had a high tolerance since I was younger.
So when you took that drug test to find out if some of these pharmaceuticals might have had other analogs in them, considering you're taking pharmaceuticals from a third world country, and pharmaceutical companies in first world countries are well known for having delivered bad batches of different types of drugs,
right,
and
right.
different types of mixes.
Yeah, the last thing I took before I came was liquid morphine, and it didn't wear off for like a day, which is not supposed to happen, or more than a day. So we think that there was something else in it, and we did a test, but we didn't find out. So it's a mystery at this point.
So tell me, what was your first memory when you came out of the Ibogaine experience?
I was really sick. I've never been sicker to my stomach. And some crazy things happened, but I came out of it feeling amazing. I was really sick, but then, it's just like my brain is cleared. Like it's like a bunch of debris just got swept out of my ears or something. I feel inspired. I've been able to do things that I never do. Like I hate cooking, and usually it's terrible, and I've been cooking and making great food. Just my Spanish has improved double. It's like all the connections in my brain are closer and firing faster, and it's just totally different. I feel fresh, like Control-Alt-Delete on the computer.
What about the thought of getting high, or the thought of craving for an opiate, or an actual craving?
There's moments where I feel restless, probably because I haven't felt anything in months, and in those moments I think about it, but even if it were right there, I wouldn't take it. It's just, this is too good. It's like the pain that I get now it doesn't faze how good I feel mentally.
So you feel content?
Totally. Like I wouldn't use anything even if it was sitting out in front of me like a buffet. Not interested.
You feel excited about Ibogaine?
Definitely. I want to work with it.
Do you think that, where do you think your life was going before you did your treatment?
Well, I was probably going to die. I was really unhealthy. I was eating like ice cream only for like a month. Had no minerals in my body. So
the some of the results show that your calcium levels were to the level of it's such a low level that
that I should have had fractures.
They call it
bones.
hungry bone syndrome.
Yeah, and magnesium, like none.
Right, and they dropped halfway through your session.
Yeah,
and that's possibly because of some of the issues that were going on in your body, and you had an ultrasound.
And a possible heart problem.
Do you want to tell a little bit about your sneakiness?
It wasn't sneakiness. I totally forgot to mention a really important detail, that I had an OD on methadone and Xanax 4 or 5 years ago, where my heart actually stopped. And I guess if you guys would have known that, I wouldn't have done Ibogaine treatment, because I might have heart damage from that. And the calcium magnesium was so low, it caused me to have a heart problem during the session. I actually had 6 cardiac arrests and went to the hospital, and was there for days. I had a pacemaker, but they took it out.
It's external.
It was external.
Bionic.
But a wire was running into me, but they took it out. My heart's back to normal. I think that I had a problem. I think maybe the Ibogaine was a factor, but I also didn't have any calcium magnesium, which your heart needs, and I might have had a heart problem already. Are you comfortable sharing
what caused you to lose the calcium and magnesium so fast? Because before, when you were tested, your electrolytes tested, your calcium levels were suspended at a normal level.
So I don't know what caused it to drop.
Okay, well, we don't need to get into the details, but you had what some people call an impaction.
Right.
We won't get into the details of that. Yeah. Anyway, what do you think about...
Wait, I want to mention something I didn't mention that was really profound for me. When I took the Ibogaine, I don't remember anything for 2 days, and I came out of it really sick, and everything turned completely white. I had no idea where I was, and all of a sudden I hallucinated that I was on the bus in my hometown, alone on the way to the hospital, and I had no idea where I was, and I remember screaming, "What country am I in?" I had no idea, and I don't know if that was dying or what, but that's like a really strong memory for me.
Did the doctor describe to you the difference between when someone has a heart attack because there's a block and the heart gets damaged and it releases troponin and a couple other enzymes, and they do tests for it? One's called a CPK, one's a troponin test. Mm-hmm. And when you passed those and you were still suffering the equivalent of an arrest, did they explain why you had the conduction in your heart was off with your QT?
Yeah, I had a long QT interval.
And it wasn't going back to normal? It
wasn't for a while. That's why they put in the pacemaker.
And so what was the conclusion for yourself after everybody had their 2 cents worth?
I think that it was the low calcium magnesium, and I think that I might have damaged my heart from the OD years ago.
So do you agree with the doc that that this is possibly the cause of eating one spoon or maybe 2 or 3 spoons of ice cream every couple hours?
There's a lot of ice cream.
A lot of ice cream, but nothing more, right?
Not very much else. Some other things.
They say ice cream has calcium in it, but that you don't absorb much. In fact,
because of the sugar.
Some people think that it takes calcium out of your body.
Obviously, it does, because my nutrition level was horrible.
So you agree with the doc that it's hungry bone syndrome mixed with Ibogaine, mixed with possible mysterious factors and Colombian pharmaceuticals, and the fact that you're a little strange on top of that?
Yes, those are all factors in this
Okay.
medical emergency, but it's almost like all of those things that happened were necessary for me to feel how I do now. And
How was it seeing your mom in the hospital?
I was so happy to see her.
All the way from Florida.
Yeah, my mom came from the U.S. It was great. She's amazing. She believes in me no matter what, and manages to deal with the situation without going crazy, which is amazing.
She's gonna be able to sleep a little better at nights now.
Yeah, I think so.
What so obviously this is going to be seen by people that are interested in Ibogaine, and you know that the whole idea here is not to promote Ibogaine treatment as much as Ibogaine awareness. And obviously we want people to take it and explore with it. But what do you feel about the fact that it might scare some people away, and also the fact that it might...
I hope this doesn't scare people, because I had other problems. I believe in Ibogaine 100%. I really want to do a lot of work to promote it for anyone that is interested. I think it's amazing. The other people I've seen here go through treatment had amazing transformations. I've had an amazing transformation. My case is unique. In my life, I typically have very strange things happen. This is not unusual for me. So this is not a typical situation.
Sure you don't want to say anything bad about Ibogaine?
No,
Okay.
I really do not. I don't.
Right.
I feel so amazing now, and it's thanks to Ibogaine. It's thanks to you guys for saving my life. So.
Okay, well, let's see. How do you feel about the Latin American news channel that wants to do a special on you?
They do?
Yeah.
That's awesome.
So you're gonna do it?
Sure.
Okay,
Hell
so
yeah.
we'll try to link it to this video whenever it comes out.
Okay.
Maybe you can translate it for people
Okay.
that don't have very good Spanish like me.
Subtitles. All right. That's
So,
awesome.
what else would you like to say? You're almost 13 minutes here. This is
a really
no one's
long
even gonna
one.
watch this far.
If you're still watching, I'd just like to say, please look into Ibogaine. Please look at a variety of testimonials. There's so many different experiences, but there's a unifying factor that everyone gets transformed and refreshed. Everybody. Please keep an open mind, and it's an amazing route. Yeah.